Hello, my name's Clare Cook, so I'm part of the mass vaccination programme and I'm the manager for outreach, which involves delivering the COVID vaccinations within the community, within trusted settings in the community. So here today we are at the mosque in Southmead and we're back for our second doses for this community. It's been so successful. It's absolutely outstanding, working in partnership with Dr. Sahal, all the colleagues here, and the uptake has just been fantastic.
I'm Karen. I'm working here as I'm a senior nurse, so I'm supporting the nurses who are vaccinating today, and our lovely people that are coming for their vaccinations. It's been an absolute privilege. It's been absolutely amazing. Everybody has been so welcoming, and it's a great privilege, as I said, just to be able to help and support people in the communities. And we're all working in partnership together, which is absolutely amazing and lovely.
Yes, so we've been doing the outreach clinics now for over 4 months, and we've been using faith settings, community centres, we've done it in temples, mosques, we've gone to all areas across BNSSU, which is Bristol, North Somerset and South Gloucestershire. We did a drop-in at Hartcliffe on Friday, which is the first walk-in clinic. We tried that was very successful, so we would like to see that roll out more. But absolutely, I think embedding it where people are, so taking the vaccine to where people are in a trusted place and working in partnership, as Karen said, this is one huge collaboration across the system, but most of all our communities are leading it. So for me, that's what's really important. Probably by the end of this we'll be looking at around about 450 people here, and that's the second doses, so that was following up, they had their first doses 11 weeks ago, so it's phenomenal. And when you have the communities leading the way, we have hardly anybody that doesn't turn up, and I've been working in the system for a long time.
Is there any age restriction for someone to come here?
So for here we've been delivering AstraZeneca vaccine, so we're looking at over 40s. So when we delivered it the first time 3 months ago, obviously that wasn't the case, so we do have some younger people coming here. They had no problems with the first dose, so they are receiving their second dose today and absolutely fine.
Karen, Head of Specialist Services for Children, yeah?
Yes, I am.
How the children are getting COVID, and what are the symptoms, and do you think there are some cases which could go worse in children?
So there are some cases in children. We know that they are generally quite mild. So at the moment there isn't a COVID vaccination for children, but it's being researched, and we're hoping by the autumn there may be an opportunity that we'll roll out COVID vaccines for children over the age of 12. And potentially we'll be able to do that for children in schools. But also there's lots of learning from doing all these community clinics. So it may be that some children and some families will prefer to have it in a setting like this or in their community rather than school. So we are going to be looking at all sorts of different options to help people access those vaccinations.
And for children, like someone got the COVID obviously, so is there any possibility they can get the COVID again?
If they're not vaccinated, yes. Yeah.
Don't you think the children vaccination should have been started earlier? The reason behind, obviously, with the social distancing and all these, obviously they are children, they do not understand much about that, and the spreading is much more wider and quicker from schools as compared to the shopping malls and other areas.
Yeah, I think there's lots of things in what you've just said. So we know that our elderly population were more likely to get COVID and get it more severely. So it was very, very important that we looked at all the research and we vaccinated those people first because they were at higher risk. Yeah. Our children get it quite mildly, so the risk factor for them is less.
Yeah. But so they could be the spreader, they can spread it quickly.
So at the moment the research is showing some of that, and I think we have to wait to have the research to back that up, and we wanted to protect the people who were going to be most severely affected, who potentially would have been in hospital. So we needed to make sure that those people were absolutely protected first, and then absolutely we need to look at our children and protect that bigger and wider community.
Yes, we have gone to other mosques, and we've also done community centres, so we've opened it up to all faith groups, which is, I think, really important. And this has been very inclusive here as well. And Dr. Sahal is that we've welcomed other congregations in, and we've opened that up. And I think if it's based in a community, I think that's really important, that everybody comes together in a place that people feel welcome and trusted, and that's absolutely what's happened here.
Some other mosque or community center wish to set up something same like this. What is the procedure for them to contact you and set up something like that?
Yeah, so that's very much what we have, and we've been prioritising, particularly looking at the data where the low uptake is. So we have to be driven, as Karen referred to, even with the children, where the evidence is showing that we need to concentrate what our resources are. So we look at what the uptake is in that area, and then we start to build that relationship with the communities to say, would an outreach clinic, would that work here? It's about a co-production. This isn't about we come and do it too, it's about we do it together. So that we are offering it, but we have to, like you say, ensure that it's in an area where it absolutely is going to be beneficial, you know, which is absolutely what we've seen with the ones that we've done. So yeah. We very much work with our community partnerships. We've been guided by what kind of communication that they would like. So these clinics we are targeting Pacific minority ethnic groups, and what we don't want is other people perhaps outside of these areas thinking, oh, I'll go there today. I think we've been very led by the community leaders saying, what is best works for your community? How do we advertise that? Does that make sense? Rather than saying, oh, well, we'll put it everywhere on the news. I think we really want to, as I say, it's about a partnership here. So we are guided by the community leaders on the best approach. Each clinic is different. So we use a lot of local media, working through the congregation and sending it out in a different approach, because we absolutely want to ensure that these clinics serve the community that they're meant to serve, rather than opening it up to everybody. If that helps. Does that help clarify that a little bit?
Thank you.